Thank you for this opportunity to speak with you today regarding establishing a proactive program to support emotional engagement, resiliency, and compassion satisfaction in research animal caregivers. The importance of raising awareness of compassion stress and building systems of support within organizations can have direct and indirect benefits for the well-being of humans and animals in their care. This proactive approach is one piece of the puzzle addressing research animal caregivers' mental health, level of engagement with their coworkers and the animals, building social supports, and increasing their level of resilience and compassion satisfaction. From the research, we know having an organizational approach to raise awareness of compassion fatigue and support resiliency is important to the well-being of people and their ability to care for the animals. However, there are not many fully developed programs within contract research organizations, academia, pharma, or governmental research organizations. In 2018, one of our facilities was conducting an internal multi-day compassion fatigue workshop. This was an opportunity to take a social science approach to identifying the root causes of compassion stress and fatigue in a research setting and measure if raising people's awareness of compassion fatigue would result in changes in responses on a pre- and post-training survey exploring how compassion fatigue can manifest in the workplace. The goal was to use this information to build an internal compassion fatigue resiliency building program. In the graph on the left, we asked those that work with animals pre- and post-workshop if they feel they have experienced compassion fatigue. We asked the same question of those that do not work directly with animals in the graph on the right. In both groups, we see a definite change in awareness and a higher percentage that feel they have experienced compassion fatigue following the training, almost double in both cases. Some of this may be a result of the sample completing the post-training survey, but it does indicate that raising awareness is a way to help people recognize indicators of these feelings in their lives. These findings were further confirmed by two cross-sectional surveys of lab animal professionals in the US and Canada that looked at compassion fatigue and support systems to help build resiliency and increase well-being and professional quality of life. In the Randall survey, 66% of respondents reported having experienced compassion fatigue at some point in their career, while 30% were uncertain if they had experienced compassion fatigue, suggesting a need for education to raise awareness. Similar results were found in Europe. The Lafayette survey looked at demographic and work factors, social support and animal stress, euthanasia, enrichment, human-animal interactions, and professional quality of life to assess coping mechanisms used to deal with compassion fatigue and to determine the beneficial components of a compassion support program. Laboratory personnel that reported higher compassion fatigue indicated less social supports, more stress and pain in their animals, and less or no choice in deciding whether they would be the ones to euthanize their animals. Personnel that reported higher compassion fatigue indicated a greater desire to provide their animals with more enrichment than currently provided. Personnel that reported higher compassion satisfaction indicated more social support, less stress or pain in their animals, and performed certain relationship-promoting human-animal interactions more often, for instance, naming their animals. And they found that trainers may be at a particular risk for compassion fatigue. In both surveys, a common recommendation for organizational supports were creating a supportive community, ensuring that social support is provided within the workplace, peer support groups, and guidance on effective ways to talk about our work. Based on the information gathered in our internal surveys and the literature available on compassion fatigue in our field, we began to develop a global initiative to provide organizational support to our employees and help support an emotionally engaged culture to build resiliency. This was our roadmap. Establish executive support, acknowledge that compassion, stress, and fatigue may occur in personnel, sensitize senior management at sites to the issue, develop network and toolkit for sites to use to begin having open discussions around this issue. Ask sites to develop a team to support and engage staff on this issue. And work together with human resources to promote employee well-being strategies, also to provide feedback to site teams, and conduct research projects. After garnering support of executive leadership, we formalized the program goals, vision, mission, and value, and branded the CR CARES, or Compassion, Awareness, Resiliency, Engagement, and Support program, to distinguish it from other company wellness programs. To raise awareness with key stakeholders, we produced targeted trainings. We began with training leaders. We developed an e-learning for site management on building resiliency at Charles River and introduced the program to global tox operation leaders. We provided training to human resources representatives in North America and Europe, introducing the concepts of compassion fatigue, the CR CARES program, and the role of social supports in building resiliency. Building a sustainable and meaningful program is not top-down, but bottom-up. What is meaningful at one site may not be at another. Site culture, type of work performed, personnel experience, communication channels, and more can all influence the program. To support this diversity and organically grow the CR CARES program, we developed a Global Resiliency Building Ambassador, or RBA, network. Local compassion fatigue and resiliency building efforts are supported by resiliency building ambassadors that are nominated by site management. The RBAs are part of a peer network that supports personnel at the local level, focusing on tools for building resiliency, peer counseling through empathetic listening, and sharing ideas for resiliency building activities and resources they have created with others that may be interested. The RBAs collaborate with other groups at the facility to engage with employees, for instance, mental health first responders, human resources, or local wellness programs. The network meets quarterly to continue exploring their shared experiences and recent literature related to compassion fatigue and resiliency building. In 2020, the CR CARES program had been introduced and multiple trainings had been provided to multiple groups, including our annual animal welfare training that focused on compassion fatigue and resiliency building. This training is mandatory for those working with or having oversight of work with animals globally. We measured the level of awareness of the program and issues surrounding compassion fatigue and resiliency among employees. Our hypothesis was that compassion stress and compassion fatigue are part of our work with animals in research. The level of awareness of these occupational hazards and benefits of building resilience would increase with implementation of training at multiple levels on the subject and introducing the CR CARES program at a corporate level with local supports. This survey offered the opportunity for another social science approach to determine the level of awareness of compassion fatigue and engagement and support programs within our employee population. We developed an 11-question post-training survey tool that included introductory and main questions that was shared with 7,189 people. 3,798 people, or 53%, returned the electronic survey. The goals were to measure perceived relevance to their work, effectiveness in raising awareness of the importance of compassion fatigue and resiliency building to our work, and identification of 1 to 2 healthy coping mechanisms that employees should be aware of to improve compassion satisfaction and build resiliency. Our sample had a range in their years of service, but the largest group was the 1 to 5 years, and the majority of respondents work with animals. With a variety of roles participating in the training, the majority were animal care and technical or research personnel. 90% found the information relevant to their work. Of the 100 people that disagreed or strongly disagreed, 66 did not work with animals. The results show increased awareness of compassion fatigue, identification of healthy coping mechanisms, and increased awareness of the corporate program of supports to build resiliency. In all areas covered in the training, we saw that greater than 70% of respondents found it extremely to very effective in raising their awareness of compassion fatigue, importance of building resiliency, identifying healthy coping mechanisms, and our organizational programs and supports to increase resiliency and compassion satisfaction. This was a great opportunity to begin conversations locally and to continue to grow local resiliency building efforts at our multiple sites. While the majority of respondents were aware of engagement activities to help to increase compassion satisfaction and build resiliency at their site, looking at the two groups, the yes and the no, not sure, there were many roles that were in common. For instance, laboratory staff, animal care, training, administration. This shows that some people know about activities, but others do not. So there is room for improvement in sharing information at the site level. Our last goal was to measure identification of 1 to 2 healthy coping mechanisms that employees should be aware of to improve compassion satisfaction and build resiliency. This is a word cloud of the responses. 63% of respondents answered this question, and the messages surrounding the importance of talking, self-care, and our connection with animals were clearly heard. Based on the survey results, our initial training efforts have been successful at raising awareness of the importance of compassion fatigue and resiliency building to our work. Respondents were able to identify 1 to 2 healthy coping mechanisms that employees should be aware of to improve compassion satisfaction and build resiliency. However, there are opportunities to improve communication and training efforts in the future. We are continually adding materials to our internal website related to compassion science. We have regular calls with the resiliency building ambassadors where they share activities at their sites to help inspire others. And we add these ideas to our toolkit for new RBAs or sites that come on board to develop their local program. In collaboration with other sites, we developed the Resiliency Building 101 Frontline Leader virtual workshop to continue our efforts to raise awareness of the role of compassion stress and resiliency building with supervisors, team leaders, managers, veterinarians, human resource representatives, trainers, and RBAs. The goal is to build an emotionally engaged culture with support of the CR Cares program to equip our frontline leaders with the understanding and tools necessary to support and celebrate their employees. We have held 3 workshops to date and have reached 238 people, or 63% of our target audience in North America. We also organize Biomedical Research Awareness Day activities to celebrate the role of animals in biomedical research and reconnect people to why their work is important to both human and animal health. We are currently developing a tool to measure local programs' success in meeting the goals of the Compassion Science program, including engagement with the local programs and their effectiveness in building an emotionally engaged culture and building resiliency and compassion satisfaction.